Hi everyone, welcome to this presentation on self-medication during the COVID-19 pandemic. My name is Michael Mung'oma. I am a pharmacist and toxicologist. I'm also a member of the Pharmaceutical Society of Kenya COVID-19 Response Task Force. Before I continue, I want to make a disclaimer that this presentation may not include all the relevant facts or even the most up-to-date research, and the presenter is not liable in the event that omissions and errors occur. I'll start with a few key facts. Patient-facing healthcare workers were 3 times more likely to be admitted with COVID-19 than non-patient-facing healthcare workers. I think this is quite important as healthcare workers to take note. This was a study that was carried out among healthcare workers and their families. It also said that the risk was doubled among household members of front-facing workers. So self-medication has several definitions. We'll look at the dictionary definition, which says it's medicating oneself without the supervision of a healthcare professional, or the use of medicines by people who do not take professional advice, or even obtaining or taking drugs or medicines without the advice of a doctor. That is known as self-medication. But the World Health Organization defines it as the selection and utilization of medicines to treat self-recognized symptoms or ailments without consulting a physician. This, again, I must say, is common practice. People walk into pharmacies or other drug outlets and they're able to self-medicate. So this can be a dangerous approach to disease management because of several reasons. One, there can be substantial delays in diagnosis of serious conditions or increase the risk of adverse outcomes. This practice has both beneficial or deleterious consequences. Remember again, when we're talking about medicines, these covers over-the-counter medications as well as prescription medications. In our settings, especially in developing countries or even some developed countries, people can access over-the-counter medications in premises that are not exclusively drug outlets, like supermarkets or kiosks or other places where they could sell analgesics or painkillers without a prescription. So however, the World Health Organization acknowledges that if self-medication is practiced appropriately, it can actually bring a lot of many possible benefits, including financial advantages, self-empowered healthcare, which touches on self-care, something that is being promoted, rapid access to treatment, and self-reliance in the care of minor illnesses. All this, again, contribute towards reducing the burden in places with limited resource settings. So self-medication during the COVID-19 pandemic that we're facing now. This, again, is common practice. Statistics show that there's a prevalence of about 32.5 to 81.5% worldwide. So this is quite significant. And the most commonly self-prescribed medications are analgesics, so for management of pain, antipyretics for fever, antitussives for coughs, antidiarrheals, calcium and vitamin supplements, as well as anabolic steroids, sedatives, antibiotics, and importantly, herbal and homeopathic remedies, which are alternative medicines that again are easily accessible, sometimes without a prescription, and some of the practitioners of these alternative medicines are unknown. I want to point out a study that was carried out very recently in the recent times of the pandemic concerning self-medication among healthcare workers in Kenya. This was carried out by several authors, David Ochonga and others. And some of the aspects that came out of this study included, one, The number of healthcare workers that were involved in the study were about 385. These were healthcare workers that were directly involved in the management and control of COVID-19 disease pandemic. So approximately 60%, which is majority, reported having taken medicines without a doctor's prescription in the last 21 days preceding that study. And what they were managing were things like headaches, migraines, joint and muscle pains. This is quite significant because, headaches or pains are also associated with COVID-19. We are all aware that there's a list of signs and symptoms that are sort of standard from the World Health Organization as well as the Ministry of Health. But more lately, we've seen that a lot of people who are affected by COVID-19 will present with other signs and symptoms that may not necessarily be included or be part of the list that is out there. So during the pandemic again, some of the conditions that enhance self-medication include malaria, common cold, and COVID-19. Remember that this pandemic has covered several seasons throughout the year. It first hit our country in March and made official at the time with the curfew and the lockdowns. So we've gone through the rainy season, the cold season, and now we're back again to the warm seasons. Medicines in the practice of self-medication include antibacterials, antimalarials, and antivirals. A lot of people are also self-medicating with vitamins such as vitamin C, which is important because it boosts the immune system. Threats such as emergence of antimicrobial resistant microorganisms are a reality. We are well aware that antimicrobial resistance is a serious global threat. It is a real issue. In fact, it has been equated to terrorism. Hypersensitivity reactions as well as dose-dependent toxicities, including dermatotoxicity, cardiotoxicity, and hepatotoxicity can arise with self-medication. So again, to note, certain supplementary minerals such as zinc are also being used in the prevention and treatment of COVID-19 symptoms due to its ability, again, to enhance innate and adaptive immunity in the course of the viral infection. Because our immune system, I think, would be the most important defense against COVID-19. Several plants and substances are also being proposed without the minimum requirements and evidence of quality, safety, and efficacy. We are in a setting where alternative medicine is something that is historical and quite important in medicine. And this has to be included in the wider context of managing COVID-19. Self-medication can give a false sense of security and distracting from hand washing, physical distancing, which are so important as part of the guidelines of COVID-19 mitigation. There are potential risks of self-medication practices. They include, one, incorrect self-diagnosis. People can come up with certain diagnoses which may be incorrect. Remember, with COVID-19, the symptoms can vary. They can start at different times within the 14 days or the 10 days, or sometimes people can get immediate signs and symptoms, and self-diagnose themselves incorrectly. Delays in seeking medical advice when needed. If you're going to just get analgesics like paracetamol because you have chest pain, then you might delay seeking medical advice, because if you're getting relief 1 or 2 days, you might say that, well, this could be related to something that I did yesterday or so on. Infrequent but severe adverse reactions. So those are so important. Dangerous drug interactions, which I'm going to give a few specifics as we move along. But it's so important that people are aware that they can't just take medications in addition to other substances or medicines or other foods could be special diets without due consideration that they could actually interact and produce dangerous reactions. The other potential risk is incorrect manner of administration, and this could include how you're taking it, how many times you're taking that medication, and for how long. Incorrect dosage is another one. People sometimes believe that if they're suffering something, maybe increasing the dosage might reduce the time when they take the medicine, which is a very common phenomenon. The other potential risk is incorrect choice of therapy and masking of severe disease and risk of dependence and abuse. There are several impacts of self-medication. I'll just put them down here, the 4 ones. Unnecessary financial burden, interrupted supply chain, organ damage, and adverse drug reactions. So just to provide a little bit of input in those impacts. So there could be unnecessary stocking of medications at home. We saw this, and this has been reported during the pandemic, where people have stocked analgesics, people have stocked a lot of vitamin supplements, and there are those that have even gone to an extreme of stocking antibiotics or stocking medications based on information they get out there from the social media, like the internet. At one point, there's a drug known as hydroxychloroquine, which was supposedly very effective against COVID-19. And at that point, a lot of people just went out to buy these things. So unnecessary stocking of medications at home, including antibiotics, in anticipation. These can create a risk to household members, including children, because medicines are not, they're not sweets. They're not things that we can just take lightly. They come with precautions. They come with very, very specific indications. And in addition to that, they also have shelf lives. So meaning they can only stay viable or remain useful for a particular amount of time. So the other impact again is poor supply of needed medications to health facilities because of the disruption caused by impulse or panic buying by the public from suppliers. Effects on long-term use of non-prescribed medicines on organs. And I want to point out again this antibiotic because it has become very useful in the management of COVID-19, azithromycin. These can cause liver toxicity, so it can cause liver damage. Adverse effects of useful medications for COVID-19 management, such as high doses of vitamin C, which is important again for boosting the immunity that is required in COVID-19, is associated with diarrhea. So people need to know that when it comes to vitamin C specifically, these can be gotten from foods or fruits of the season, like oranges. Overdosing yourself with high doses, 1,000 milligrams or above, come with side effects like diarrhea. Some people might not notice, but again, diarrhea will come with its own consequences, like dehydration. I just wanted to point out again some important drug interactions with very specific drugs that are used in the management of COVID-19. And one of them is rivaroxaban. This interacts with ARVs, so meaning patients who are on ARVs need to be cancelled. One also need to be investigated very well before administration of these medicines, because they have a potential of increased risk of bleeding. This drug is an anticoagulant. So the alternative, again, agent there is something that people need to know as healthcare workers, and that is dabigatran. Dexamethasone, a steroid that also has anti-inflammatory properties that is very useful in the management of COVID-19 because there is inflammation that is associated with this viral infection. Doesn't do very well with certain drugs like warfarin, which is an anticoagulant, because when taken together, it can inhibit the response to warfarin. Non-steroidal anti-inflammatory agents like the common aspirins or ibuprofen can increase the risk of GIT side effects. Hydroxychloroquine, which is a very controversial medicine that came with a lot of information and disinformation during this pandemic. When taken together with digoxin, and digoxin is a drug that is very, very important for managing certain cardiovascular disorders like congestive heart failure, so a failing heart. When these are taken together, these can increase serum digoxin levels. Insulin or other or other anti-diabetic drugs, when taken together with hydroxychloroquine, enhances the effects of a hypoglycemic treatment. So meaning the reduction of blood sugars is worsened. So a decrease in doses of insulin or anti-diabetic drugs may be required. Other drugs that are used for other cardiovascular disorders such as arrhythmias, which is abnormal heart rhythms, when taken together have a potential to induce cardiac arrhythmias. There is antibiotic ampicillin, which belongs to a class of penicillins. And sometimes what happens is that if one drug is seen to have an interaction with another one, then usually most other drugs that belong to the same class would tend to have the same sort of profile. So with ampicillin, there's a reduction in the bioavailability of that ampicillin, meaning the amount of that antibiotic that actually gets into your system. So these can have an impact in the treatment of that infection that you actually took the antibiotic for. Certain recommendations regarding self-medication during COVID-19 include that one, good healthcare seeking behavior should be promoted even among healthcare workers. So that's very important because some healthcare workers sometimes do not seek healthcare because they believe that they would take care of themselves. So it's so important that people are able to have the conversation and be able to be free to actually seek good health care. Second, avoid practicing self-medication using antibiotics, antivirals, and antimalarials, as well as other prescription-only medicines. Yeah, because of some of the reasons that I mentioned earlier. We have an issue of antimicrobial resistance. We also have other issues regarding the effect of antibiotics, for example, in our gastrointestinal tract. We know that long-term use of antibiotics can also influence our own normal flora, which are microorganisms that are naturally present in us that contribute towards the overall immune system, which is our normal defense. Thirdly, comprehensive health education must be carried out through continuous medical education in our institutions. If you're in a hospital, a clinic, or in an institution, an educational institution, or even in the community as a healthcare worker, I think comprehensive healthcare education must be carried out through continuous medical education to promote awareness on the possible risks of self-medication. Lastly, strengthening the enforcement of COVID-19 mitigation measures while supporting healthcare workers with resources to enable them adhere to COVID-19 prevention guidelines. And this is so important, especially if you're a healthcare worker in a management position or a policy implementation position, that you're actually able to provide this support or ensure that healthcare workers are provided with these resources adequately and in good time. Before I conclude, there are frequently asked questions about COVID-19, but this is not exhaustive. One, is antibiotic therapy recommended for treatment of COVID-19 patients? So the World Health Organization guidance does not recommend antibiotic therapy or prophylaxis for patients with mild or moderate COVID-19 unless signs and symptoms of bacterial infection exist. So it's important again for facilities to be able to improve their ability to determine whether there is bacterial infection in COVID-19 patients so that we can judiciously use these antibiotics, given the fact that one, they contribute towards antimicrobial resistance, and two, that they're also costly. Second question is that what percentage of patients with COVID-19 need to be hospitalized? So most patients, about 80%, recover from the disease without needing special treatment. But this is not to say that people should not seek medical help if they have COVID-19 or if they have COVID-19 signs and symptoms. And for the majority, especially children and young adults, illness due to COVID-19 is generally minor. But, however, for some people, it can cause serious illness. So it should not be underestimated in children as well as young adults. Third question that is normally asked, what is the recovery time for coronavirus disease? And this is quite important to most people because they need to know when they can be free to do whatever they normally do. So studies or research has shown that the median time from the onset to clinical recovery for mild cases is approximately 2 weeks. But it is 3 to 6 weeks for patients with severe or critical disease. Again, this is just a guide because with comorbidities, with pre-existing conditions or other conditions, then these can take a long time. And in addition to that, more lately, they've said that post-COVID-19 signs and symptoms can persist even up to 1 month. Some of those include fatigue and other mild signs and symptoms. Do blood pressure lowering medicines make COVID-19 more severe? No, in fact, the opposite is true. Having uncontrolled high blood pressure is itself a risk factor that increases the likelihood of serious illness if one gets infected with COVID-19. So if you know that you have hypertension or high blood pressure, you need to continue taking your medication and also doing other non-pharmacological actions or measures, including addressing lifestyle, whether it is food or other stressors that contribute to the high blood pressure. Thank you.